51 of our Happy Birthday Wellness Quiz, your health, nutrition, and wellness podcast brought to you by Kike Afya. My name is Birio Bobo. I'm a medical doctor as well as a public health specialist. In this episode, I'll be discussing the health hazards of belly fat in women. I discussed this topic last week, but due to demand, I thought I should bring it up again so that I can bring in some more insights. Now, in case today is your birthday, I wish you a happy one and many more candles to blow. I also want you to know that there's no better birthday gift than to be in good health. So do me a favor, if your friend's parent, spouse, sibling, or colleague is having a birthday, I want you to check on them to see when they were last screened for cancer, blood pressure, blood sugar, pap smear, among others. You're also welcome to subscribe to my YouTube channel to learn more about using lifestyle changes such as diet, exercise, weight management in managing lifestyle diseases. I'll be discussing the latest science on how to screen for and manage high blood pressure, obesity, cholesterol, high blood sugar, screening for and managing cancers of the colon, breast, cervix, as well as prostate. I'll also be giving tips on harmful use of alcohol, smoking cessation, and road safety. Just as a background, according to World Health Organization, 80% of heart disease and 40% of cancers can be prevented if all individuals stop smoking, exercise regularly, cut out or reduced alcohol intake, and ate a healthy diet. Remember that wellness checks are appropriate for all age groups, from children to teens and to adults. And again, please don't forget to subscribe so you don't miss out on subsequent episodes. By the end of this episode, you should be able to define 5 body shapes or types. You should be able to distinguish between body weight as measured by body mass index and body composition measured by the waist circumference. You should be able to explain why men gain weight differently from women. You should be able to explain how to measure body fat. You should be able to explain why body fat causes health problems. And then you should be able to discuss ways to reduce belly fat. And then I'll sum up with 7 takeaways. Now here is a quiz for which I will share the answer at the end. Now a 47-year-old lady goes to see her doctor and she's diagnosed with type 2 diabetes. She weighs 90 kilograms and her current body mass index is 30 kilograms per meter squared, which puts her in the obese category. Her waist circumference is 110 centimeters. She also complains of pain in the knee. The doctor decides that she needs to lose weight. So what is the realistic initial weight loss goal for her for the next 6 months? A, 20 kilograms. B, achieving a BMI below 25 kilograms per meter squared. C, 5-10% of baseline weight. D, her desired weight loss goal. And E, none of the above. So I'll give the answer at the end. So men and women store fat differently, and this has health implications. When men gain weight, they tend to develop potbellies, what you call also spare wheel tire, or people have different names for it, because it is the default storage place. However, when they run out of that storage space in the belly, the fat starts to accumulate in the liver, the pancreas, and muscles. And this is when you start having medical issues such as type 2 diabetes, high blood pressure, high cholesterol, and heart disease. So basically, sometimes when it comes to fat accumulation, it's not about the size, it's about where the fat is located. Now, on the contrary, women, because of estrogen, they tend to store their fat in their hips, legs, especially the thighs and the buttocks. So fat in these storage areas can give women the energy when they are pregnant or breastfeeding. But of course, men don't breastfeed or become pregnant, so that fat is not even useful. So genetically, women have more capacity to store fat than men as per their survival mechanism. However, if women's fat storage areas in the hips and legs fill up, they too can develop a belly fat, putting them at risk of medical problems, associated with a full pot belly. Also, once women reach menopause, their estrogen levels drop, so they stop storing fat in the hips and legs and begin storing it in the belly, just the way men do. This explains why some older women can develop pot bellies just as men do. Now, in some cultures, having excess fat is regarded as a sign of beauty in women and wealth in men, which I think should not be the case. If you look at these photos here, for example, this lady, you can see most of her fat is actually in the hip area, which I think is not really bad. If you look at this lady, the fat there's too much fat. You can see fat in the legs, thighs, hips, as well as the abdomen and even the chest. Of course, this is a man. As you can see, it's a pot belly. Normally, men will store their fat in the belly. Rarely will you find men storing fat in the thighs or buttocks like women. Now, this ladies here, it's very interesting because if you look at all of them, number 4, 5, 6, and 8, most of them have excess fat in the abdomen. And because you can see it has accumulated all the way from the thighs, the buttocks, the hips. But this lady here seems to have some leeway. You can see most of her fat is still in the thighs and the buttocks, but the hip area doesn't look very, very bad for her. So that's basically how we tend to, but I'll show you how to measure that fat objectively. So they're about different body shapes. It's important to understand different types of body shapes associated with excess fat because they have health implications. Now, if you tend to store fat above the waist, your shape is apple-like. If you tend to store it below the waist, your shape is what you call pear-like. So while fat distribution varies between people and depends mostly on genetic factors, women tend to be pear-shaped while men are more likely to be apple-shaped. This means that women usually store their fat in their buttocks, hips, and lower abdomen, as well as the thighs. Now, apple-type body shape, what is also called abdominal obesity or visceral obesity, is probably the most dangerous of all. And apple body shape is considered at the highest risk for health issues compared to other body types. So remember, large waist can mean higher risk of heart disease, stroke, type 2 diabetes, as well as death. Now, having a hourglass body shape means that when you gain weight, it's not concentrated in one area like apple shaped or pear shaped. That means weight gain can be hard to spot if you're not regularly checking on the scale. Now, an inverted triangle shape is another type of body shape, and in women this could present as a larger bust, which is often mistook as increasing risk for breast cancer. However, it's not necessarily the size of the breast that puts you at risk of breast cancer, and you can determine your breast density through regular mammogram kind of test, which is used for assessing that. Now, slender celebrities tend to have the ruler or what you call the column body shape. So just be aware of these body shapes, but remember we said the most dangerous one is usually this one, the upper one. This is the most dangerous of all. So it's important to understand different body shapes associated with the excess body fat because, as I said, it has health implication. Now, if you tend to store fat above the waist, your shape is apple-like. If you store below, it's pear-like. Now, fat distribution varies between people and depends on age, gender, hormonal status, as well as genetic predisposition. But generally, women tend to be pear-shaped, while men are more apple-shaped. The apple-shaped body type, as I mentioned, also known as abdominal or visceral obesity, I said is the most dangerous because it's linked to various heart diseases, including cancer of the breast as well as cancer of the colon or bowel. So it's important to distinguish between two types of fats also. Subcutaneous white fat, the one you see here, this subcutaneous, is pinchable and is found just below the skin, anywhere in the body, especially around the waist, hips, and butt. Now, subcutaneous fat is associated with secretion of hormones such as leptin, which tells you whether you're satisfied or not, and which signals satiety in the brain. It also secretes another hormone called adiponectin, which is involved in glucose and lipid regulation. The deep belly fat, this one here, is the most dangerous that we need to be really concerned about. It tends to encircle the heart, the liver, the pancreas, and other visceral organs, hence the name. It's far more dangerous and it's associated with low-grade chronic inflammation. So it's the visceral fat, not the subcutaneous one, that correlates with greater risk of metabolic syndrome as well as the attendant chronic diseases that I'll be talking about. So briefly then, how do you then measure your waist or body mass? Now, there are different ways of measuring body fat, and I will be focusing on the first three. the body mass index, waist circumference, as well as waist to hip ratio. Now, this is a very easy thing to do, something you can even do yourself at home. Now, BMI or body mass index is not a very good measure for health and well-being because the health risks associated with obesity are not related only to size, but also to location where the fat is located. So if you're apple-shaped but not overweight, meaning if your body mass index is under 25, you can still be at higher risk of cardiovascular disease, cancer, diabetes than people with smaller waists. Therefore, it's not enough to simply measure your BMI and leave it at that. A BMI is calculated by dividing your weight in kilograms by your height in meters squared. It is used to categorize people as underweight, healthy weight, overweight, as well as obese, as indicated in the chart there. I said BMI's major limitation is that it doesn't take into account the muscle, how much muscle you have, or the fat distribution, meaning that a rugby player who is active and somebody who doesn't do any exercise of the same height and weight would have the same BMI score. So besides BMI, then you normally look at waist size, which can signal trouble for both men and women. So for men, if the waist is more than 102 centimeters, or in women, if it's more than 88 centimeters, that could signal problems. Now, to measure waist circumference, you basically place the tape measure at the top of the hip bone, then breathe out normally before taking the reading. The other measurement is the waist-hip ratio, which we'll be discussing in the next slide. Now, let me just share a quick quiz, the quiz here, which I think I said we'll discuss at the end. So waist circumference, waist to hip ratio is another measurement, which is calculated by dividing the circumference of your waist by that of your hips. Now, in women with a ratio of 0.85 or more, and men with a score of 0.9 or greater are deemed to have high risk levels of visceral fat. For women, a low risk score of 0.8 or below, while moderate risk is 0.8 to 0.85, whereas above the 0.85 or higher is considered high risk. In men, a low risk is 0.95 or below, a moderate is 0.96 to 1, while high risk is 1 and above. Now, waist to hip ratio came from a study presented at the European Association for Study of Diabetes in Stockholm some years back. So it tracked the health records of about 50,000 adults who had died. The experts measured how likely a person was to die early based on their BMI compared to waist-hip ratio or fat mass index. A fat mass index basically is a measurement which accounts for the amount of fat somebody is carrying compared to their height. So the results showed a linear relationship between waist-hip ratio and increased risk of death. So remember, as your waist-hip ratio increases, the risk of death also tends to increase. So the question is, why does excess fat cause health problems? One, we know that visceral fat grows deep within your abdominal cavity and it fills the space between the organs. It also produces hormones and inflammatory markers. And also stress hormone. If you're stressed, then the stress hormone called cortisol tends to increase the storage of visceral fat. So but the visceral fat then leads to various diseases such as dementia, heart disease, type 2 diabetes, colorectal cancer, as well as breast cancer. So it's a very, very serious situation. So how do you reduce visceral fat? WHO looks at the way to decrease obesity is you need to decrease the intake of energy dense foods that are high in fat, sugars, and consume but low in vitamins and macronutrients. So things like, for example, white flour, sodas, juice, most of these processed foods which contain very high amount of calories. The other thing is to increase physical activity. Exercise at least 30 minutes per day to lose weight, and combine that with abdominal strengthening exercises to strengthen your tighten your muscles. So remember, the exercise should be done at least 5 days a week, 30 minutes a day. That is moderate intensity activity. So it doesn't matter how heavy you are, Modest weight loss can have a major benefit in terms of risk reduction and health improvement. In fact, studies have shown that only 5-10% of your weight loss produces the same improvement in risk factors for a person with a BMI of 27 and one whose BMI is, say, 42. So although the greater the weight loss, the greater the risk factor benefit, it's not necessary to get every patient to an ideal BMI. But the more weight you lose, the more the benefits. Also remember, adequate sleep is also very important. Stress management, because remember you said stress increases the deposition of fat in the visceral area. So limit your alcohol intake, because alcohol has a lot of calories, around 7 calories per gram. And then also avoid the so-called trans fats. So basically our quiz today was a 7-year-old lady who went to see her doctor and was diagnosed with type 2 diabetes. She weighed 90 kilograms and her BMI was 30 kilograms per meter squared, which put her into obese category. She had a waist circumference 110 centimeters. She was also complaining of knee pain. The question was, what is the realistic initial weight loss goal for her in the next 6 months? The answer is 5 to 10% baseline weight. Now, during weight loss discussion, it's important to understand the patient expectations and assess whether the goals they have are realistic. Remember, sometimes the patients can have unrealistic goals. Now, according to several professional guidelines, such as the American Heart Association, the American College of Cardiology, as well as the Obesity Society, a reasonable initial weight loss goal should be to lose approximately 5 to 10% of your baseline weight. If a patient chooses to start diet, exercise, and behavioral changes, then 15% within 6 months seems quite reasonable. And studies have shown that it can actually improve your blood pressure, improve your blood sugars, improve your cholesterol, as well as improve your quality of life. It's important to also inform the patient that even losing 3 to 5% of their baseline weight can improve many of their weight-related comorbidities, such as blood sugar, as well as triglycerides. But remember, you have said the more the weight loss, the greater the benefit. So, in terms of takeaway, obesity is when you carry too much fat in your body, placing you at health risk. Too much fat around your middle, what you call apple shapes, puts you at higher risk of heart disease, type 2 diabetes, as well as cancers, even if your weight is normal. Obesity has been linked to heart disease, hypertension, type 2 diabetes, heart failure, heart attacks, stroke, as well as cancer, especially cancer of the breast and cancer of the colon. Obesity can be measured using BMI, waist circumference, or waist to hip ratio. Now, a waist circumference of more than 88 centimeters signals trouble in women, and more than 1 or 2 centimeters in men also signals problem. The other measure you can use is waist to hip ratio. If it's more than 0.9 in men, it means you are at risk of visceral fat. If it is more than 0.85 in women, then you are at risk of the health hazards of visceral fat. So to deal with obesity, you need to exercise more, eat fewer calories, get enough sleep, limit alcohol, as well as your stress levels. Thank you very much for listening. This podcast was brought to you by Kike Afya. My name is Subiri Ubogo. I'm a medical doctor and public health specialist. Until next time, bye-bye. Please remember to share this with your friends and family. Until next time, bye-bye.